Welcome to today's video, where we'll be discussing nasal vestibulitis, a common but often overlooked condition affecting the nasal passages. We'll delve into what it is, what causes it, and how it's treated, providing you with a comprehensive understanding of this ailment. Nasal vestibulitis is primarily caused by bacterial infections, most commonly Staphylococcus aureus. These infections often arise from seemingly harmless activities like nose picking or excessive nose blowing, which can create small abrasions or fissures in the nasal vestibule, the area just inside your nostrils. These breaks in the skin act as entry points for bacteria. Other contributing factors can include nasal hair plucking, which damages the hair follicles, and nasal piercings, particularly if aftercare is inadequate. In some cases, underlying conditions like diabetes or immunosuppression can increase susceptibility to infection. The pathophysiology of nasal vestibulitis centers around bacterial invasion of the nasal vestibule. When Staphylococcus aureus or other bacteria gains entry through skin breaks, it triggers an inflammatory response. The body's immune system rushes to the site, causing redness, swelling, and pain. The infection can remain localized within the hair follicles, leading to folliculitis, or spread to the surrounding skin and subcutaneous tissue, resulting in a more diffuse cellulitis. In severe cases, the infection can potentially spread further through the facial veins, though this is rare with prompt treatment. Nasal vestibulitis is a relatively common condition, though precise epidemiological data is limited. It affects individuals of all ages and demographics. People who are prone to frequent upper respiratory infections, allergies causing nasal irritation, or those who work in environments with high dust or particulate matter may be at a slightly increased risk. Individuals with diabetes, weakened immune systems, or those undergoing certain medical treatments are also more susceptible. The signs and symptoms of nasal vestibulitis can vary in severity. Typically, individuals experience redness, swelling, and tenderness in the nasal vestibule. Small pimples or pustules may appear around the base of the nasal hairs. Pain is a common complaint, and it can range from mild discomfort to a throbbing sensation. In more severe cases, there may be crusting or scabbing around the nostrils, and the infection can spread, causing cellulitis of the surrounding skin. Rarely, fever and systemic symptoms may occur, indicating a more serious infection. Diagnosis of nasal vestibulitis is usually based on a clinical examination of the nasal vestibule. A doctor will assess the characteristic signs and symptoms, such as redness, swelling, and the presence of pustules or crusting. In most cases, no further testing is required. However, if the infection is severe, recurrent, or not responding to initial treatment, a bacterial culture may be taken to identify the specific organism causing the infection and guide antibiotic selection. In rare instances, a biopsy may be considered to rule out other conditions. Nasal vestibulitis doesn't typically have subtypes, but it is classified as mild or severe, depending on the extent of inflammation and the presence of complications. Mild cases usually involve localized folliculitis, while severe cases may involve cellulitis and potential systemic symptoms. Treatment for nasal vestibulitis focuses on eradicating the bacterial infection and reducing inflammation. For mild cases, topical antibiotics such as mupirocin or bacitracin are often effective. These are applied directly to the affected area several times a day. Warm compresses can also help to soothe the area and promote drainage. In more severe cases, oral antibiotics may be necessary. Pain relievers like acetaminophen or ibuprofen can help manage discomfort. It's also crucial to avoid picking, scratching, or blowing your nose excessively during the healing process to prevent further irritation and spread of the infection. Prevention of nasal vestibulitis revolves around maintaining good nasal hygiene and avoiding activities that can damage the nasal vestibule. Avoid picking or scratching your nose, and refrain from plucking nasal hairs. If you must blow your nose, do so gently. Use a saline nasal spray to keep the nasal passages moist, especially in dry environments. For individuals with diabetes, maintaining good blood sugar control is essential to prevent infections. If you have a nasal piercing, follow proper aftercare instructions meticulously. The prognosis for nasal vestibulitis is generally excellent with prompt and appropriate treatment. Most cases resolve within a few days to a week with topical or oral antibiotics. However, if left untreated, the infection can spread, potentially leading to more serious complications like cellulitis, or in very rare instances, cavernous sinus thrombosis. Recent research has focused on antibiotic resistance patterns in Staphylococcus aureus, highlighting the importance of using antibiotics judiciously. Novel topical antimicrobials are also being investigated as potential alternative treatments for nasal vestibulitis.